just so we can go ahead and get started. And I'll ask if everyone would kindly go on mute for this. So thank you all so much for joining tonight. This is a really important conversation, and one that I'm really truly honored and privileged to be just facilitating in terms of the voices that we're going to hear tonight from perhaps two of my favorite colleagues that I've interacted with in my time in medicine. The guests that we're going to have tonight are truly wonderful people, and I'll introduce them both and then talk a little bit about. And we're also blessed to have tonight Sheila Davis, who's the CEO of Partners in Health, and we've invited Sheila to say a few words about the context of this evening. Let me begin by introducing Willy Jean Louis. Willy is a Haitian surgeon born in Cape Haitian. He went to medical school in Haiti at one of the finest medical schools there, did his general surgery residency there, and then went on to do a fellowship in plastic surgery that we were a part of. Willy is faculty at the surgery department at HUM, the University Hospital in Mirebalais, in part there as general surgery as well as plastic surgery. This is the hospital that many of you who know Haiti well know. Partners in Health is very involved there. Paul Farmer was very involved there. And it's really a magnificent place in Haiti, and really the beacon of academic medicine and in many ways medical excellence in Haiti. When I was looking for a picture of Willy for this, I actually came across this, and remarkably, it's 10 years ago when Willy was first beginning his medical career. And this was a quote from Partners in Health. "What I really dream of is to improve access and the quality of surgical care, especially in my hometown where there's a real lack of good surgeons. But it's not clear that I'll be able to because everything is so difficult to change." And there was a very inspiring blog about Willy and his desire to be trained in Haiti, to help people there, both in the cities and in rural areas. And I had the privilege of being involved in Willy's training. We started in partnership with Roger Mixter and several others, a fellowship in Haiti to formally train plastic surgeons. And now here we are tonight talking about not just the ability to have trained surgeons, but now the abilities of surgeons to practice and actually carry out their work because of so many of the challenges. And Laëlle is also someone who is incredibly special in the Haitian surgical community and far beyond. Dr. Mangurat is a general surgeon. She's currently doing her MPH at the University of South Florida in Tampa. Laëlle has tremendous professional experience, including working in Doctors Without Borders at the Trauma Center in Port-au-Prince, as well as in Gonavie. She's also done work in the USA and France, and she's worked around the world promoting global surgery. She's a member of several organizations, including the Global Surgery Umbrella, the American College of Surgeons. And I think we should very proudly note that Laëlle is the first female Haitian member of the American College of Surgeons, something I know she's very proud of, as well as the Association of Teachers of the State Union of Haiti. And Laëlle is very interested in medical education and in surgical education. Interestingly, the purpose of this talk was not what we originally had it scheduled as for tonight. Originally, we were going to have a webinar, a conversation about global surgery, the work that's going on in Haiti and global surgery training and education. But of course, as I would suspect everyone on this call and everyone who knows and loves Haiti understands the situation there currently and the rapid deterioration that's happened even in the last few weeks. Both Willy and Laëlle and I thought it would be frankly inappropriate to have a sort of academic conversation about global surgery and not use this opportunity to refocus the conversation, to bring awareness and advocate for people to understand what is happening in Haiti and how it is affecting not only patients and their families, but our surgical colleagues and their ability to practice and teach as well. I'm just going to show this photo. This was from just a day or so ago that was recently published, and I'm going to stop screen sharing now, and let me come back on camera, and perhaps I can ask Sheila Davis to say a few words. As I mentioned before, for those of you who are on, she's the CEO of Partners in Health, an incredible organization that does amazing work all around the world, but with very, very deep roots in Haiti. It's one of the global health organizations that I admire tremendously, and I admire Sheila and all her leadership and work she's done. So Sheila, I think you would probably be the most appropriate person, given your international scope, to maybe give a few minutes overview of your thoughts and what you're seeing, and then we'll open the conversation to Willy and Laëlle, and then we can end with questions and additional discussion and therefore. So Sheila, please.
Thanks, Chad. Thanks so much for inviting me, and certainly so glad to be here. And I'm obviously not the expert of care delivery that's happening, and so glad that Willy and Laëlle are here today to talk about that. But as an organization, we are really challenged right now. I think this is the worst that we've seen in decades. We've been in Haiti since the late 80s. And are obviously concerned about what's happening. Fuel is our biggest challenge every day, and we're trying to secure ways of purchasing it through the DR, which is complicated, as you can imagine, because of safety. Our staff, as again, the experts on the phone will be able to share more than me, but our staff, who usually have been rotating from Mirablé in and out over a period of a week or so. Now the staff that's at Mirablé have been there for 3 weeks, still continuing to work because it's not safe to move people in and out. Our 17 facilities that Zanmi Lasante works in collaboration with the Ministry of Health are all still open, but there's reduced services at most of them because of staff, or because of shortage of supplies, or because of fuel challenges. And so we know that care is being impacted, and know that there's about 40% fewer patients who are showing up for outpatient at Mirablé, for example, but the ER is obviously very packed. And I think I'm most worried about those patients who are not getting in, who obviously need care. And we know that for every one patient in a conflict area that's impacted directly, that 9 more are impacted from other not having their chronic diseases treated, from certainly dying from other non-violence related issues of obstructed labor, et cetera. So we know that this impact is huge for the people of Haiti, which is tragic across the board. You know, I get asked all the time of whether PIH is going to stay in Haiti. I get asked that daily by donors or by media, and Haiti is the heart of PIH. Every PIH site, except for Russia, was actually started by somebody who was from Zanmi Lasante or trained at Zanmi Lasante. So it really is the thread throughout PIH that our mission, that Paul was started in Haiti, and our mission has certainly expanded around the world. But Haiti remains our largest site, 6,000 employees, and by far the place where our most expert medical and clinical care is happening. And really look forward to the day again where we can have Mirablé be the center of training for all PIH sites. And we haven't been able to do that for the past few years. But I was glad to hear that this conversation was happening, because we need to keep Haiti in all of our minds, and really advocate for certain things, such as the humanitarian corridor that we're trying to advocate for, to be able to get supplies in and out through the DR. The UN air bridge is operational, but it's not necessarily helping. It's helping get people out of Haiti. It's not helping in terms of the supplies yet, but we're hopeful for that. But I think that the PIH community around the world of 18,000 people are always checking in with our ZL colleagues, and we have a phenomenal team led by Dr. Lambert, who's leading Zanmi Lasante at this point. So appreciate everyone being on this call, and I'll be able to stay for just a part of this, but I think it's important that we also look towards the future. And another question we get asked is whether we're going to keep our residency programs open. And of course we are, because we know that we need to take care of people today, but also ensure that there's the future of clinical experts for Haiti and beyond. So thanks, Chad, and thanks for asking me to be here.
Of course, thank you so much. Can I just ask everyone to go on mute, please? Thank you, Mackinson. One of the other Haitian surgeons, I think, just joined. If you don't mind going on, Mackinson, thank you.
Yes, I will.
Let me just sort this out, guys, so we're not disrupted. There we go. Thank you, Mackinson. Sheila, thank you so much. Everyone appreciates your advocacy and that of PIH and the incredible work you do. I do also want to just say good evening to Claudia Otanka. Claudia is the executive director of the G4 Alliance, an organization that I become involved with in helping run the children's surgery group. This was going to be the initial focus of the conversation. As I mentioned earlier, the G4 represents about 70 global surgery organizations at the multilateral level, trying to do events like this to raise awareness, advocacy, and other things. So, Claudio, thank you for being here this evening. So, with that, I think we'll just begin. And these are some questions that we've put together, as well as from others who I know are passionate about Haiti have asked that we raised tonight. So, Willy, maybe we can begin with you. How would you describe the current healthcare situation? What is it like today in the hospitals amidst this political crisis?
Hi, everyone, and thank you, Dr. Perlyn, for setting up this talking together, this meeting. It's a real pleasure to be here, and thank you for having me. I think this situation is terrible. I mean, we have reached an unprecedented level of deterioration of the healthcare system in general in the country. But I would say the most surprising thing for me is the rate, I would say the rapidity of which this is being unfolding, like, which makes it, in my opinion, even more dangerous because there is no time to adapt or prepare for anything. I mean, we always had problems in the healthcare system in general. For example, I mean, as you know, access to surgical care has always been a challenge in the country, but never at this level before. And to put this into context, I'm going to compare this to the earthquake in 2010, which, as you know, had a huge toll on the healthcare system in the country. And the General Hospital, which is the biggest public hospital in the entire country, was destroyed, right? But what's interesting for me, and the reason I even mentioned this, is that even though the building of the hospital was then destroyed, the hospital didn't stop providing care at that time. I remember this because I was then in medical school, and this is where I was partly being trained. And I remember this, they had set up tents in the hospital yard, and we kept working and providing care to people. But today, amidst this political crisis, and because of gang violence, this same hospital, the General Hospital, is completely shut down. So it is a very dire situation where millions of people lack complete access to healthcare.
Yeah, that's an amazing analogy to think about it. That during the earthquake, the infrastructure was destroyed, but the healthcare system remained reasonably intact. And in this situation, the infrastructure is intact, but the healthcare system is completely destroyed. Tell us what are some of the specific issues that are happening there? It looks like you just went dark. I don't know if it's an electricity issue or just the lights.
This is a motion sensor light. I'll just
got it.
Yeah, give me a second.
Perfect.
Yeah.
Tell us some of the specific challenges. Why is the healthcare system essentially shut down today?
So I'm sorry for this interruption. Like, you know, we have to save every little bit of energy. So
Of
that's
course.
why we have this system. So yeah, I mean, so this situation is very challenging, I would say, like for both patients and healthcare workers alike. I mean, not at the same level, obviously, because I can't even imagine what the patients are going to trying to navigate a collapsing healthcare system while dealing with whatever condition they are suffering from. Right? It must be a definite total nightmare. But the healthcare workers are affected as well in different levels. Like first, as Asians living in the same conditions, we are facing the same challenges as everyone else in the country, right? And this entire situation is very stressful for everyone. But there is also this sentiment, personally, a sentiment of frustration, of lack of power, for not being able to care for patients as we would like to. But it is also worth mentioning, but there are actually two different situations in the country unfolding right now. First, there is Port-au-Prince, the capital, which is literally under siege, and where approximately 2 million of people are being trapped and are lacking the most basic of life supply, including water and, of course, access to healthcare. As of right now, there is like no way in out of Port-au-Prince. Like there's no way in and there's no way out. I mean, we have heard about helicopter charter flight from Port-au-Prince to the Dominican Republic for apparently $10,000 to $15,000 a seat. But obviously, this is not for the average population. And that's why I said there is no way in or out of Port-au-Prince. Everyone is being impacted. But of course, the most vulnerable people are being affected the most. And that includes children and pregnant women. The mass majority of the hospitals are completely closed. And I would say that the basic population of Port-au-Prince has no access to healthcare. For the few hospitals that are trying to remain open, it's very challenging because the staff can't always reach their workplace, their hospitals. So it's almost impossible. And there is also this different reality of the rest of the country, which is equally affected by the situation unfolding in Port-au-Prince, because the supply chain is very disrupted at the moment in the entire country. We were talking about supplies earlier. Most of the necessary supplies to keep hospitals up and running, including fuel, for example, are coming from Port-au-Prince. We also have the same staffing problem that I mentioned earlier about Port-au-Prince. Many of our staff are living in Port-au-Prince where they are trapped and can't come to work. And also many of them, of the ones, including me, like, who are lucky enough to be in Mibale, are desperate because, we have families and some have children in Port-au-Prince that they can't go back to. And so that's why this is like a very challenging situation.
Yeah, amazingly. So, Laëlle, tell us, what you've been hearing from your colleagues in different parts of the country. Willy mentioned supply chain. What's happening in terms of supplies being able to get to the hospitals and the need that you're seeing? And also, I know with your expertise in public health and epidemiology, if you want to comment on, what your concerns are with that, please do.
Thank you, Dr. Perlyn. From my colleagues, I heard that the ongoing political crisis in Haiti is having kind of far-reaching impacts across all sectors. From a medical standpoint, the closure of key transportation hubs, including the main airport and port, because they are located in Port-au-Prince, coupled with widespread roadblocks, has severely disrupted the supply chain in Haiti. In addition, the escalation of this violence has led to the destruction and damage of healthcare facilities, including storage facilities for medical supplies and equipment. Consequently, hospitals are now facing shortages and delays in procuring essential materials and equipment, which are very crucial for patient care. And I think the resultant scarcity will drive up to the cost of these items making them less affordable for a population for this population in Haiti that already contribute to nearly 50% of medical costs through out-of-pocket payment when they seek medical care.
You know, with that in being the case, and there really being so limited space, Willy, how are you actually able to do surgery? The amount of trauma we've been talking about is huge right now. There's all the regular medical needs, of course, and without even things like anesthetic gas and drugs, how are you even able to proceed right now? Where are you? You're on mute, Willy.
Yes, that's a very good question. It's very interesting because, I mean, as as I mentioned earlier, like we are operating in scarcity. But to be clear, healthcare in Haiti has always been operating in scarcity, and I mean, we just have to look at the numbers, to understand this, because I mean, we cannot talk about supply without talking about cost, right? Like I just said, and just so people can understand, for example, the health expenditure per capita in Haiti is $58. Basically, what that means is that on average, the amount of money that's being spent for the healthcare of each person in the country is $58 a year, which is the lowest in the America. I mean, and the reason I didn't say in the entire world is because there are a few countries in the African continent where this is slightly lower. But to put this into perspective so people can really understand, the health expenditure per capita in Canada, for example, is $6,470. And it is like $12,000 in the US. So $58 is a very low number, even when compared to other poor countries in the region. For example, it is $254 for Honduras, and it is $417 for the Dominican Republic. So when it comes to surgery, the situation is even worse because most of the funding comes from external sources. Like I just mentioned out of pocket, but in general, most of the funding for healthcare in Haiti comes from external sources, which have always, I mean, but for reasons that we all understand, they always been prioritizing medical conditions like infectious disease as opposed to surgery, which this is why, because which it used to be the main burden of disease in developing country. And actually, even though I would say like tremendous effort have been made in this sector with quite remarkable achievement. And actually one that is worth mentioning is for example, I mean, like Shea Davis was mentioning earlier, Zanmi Lasante as PIH is known in Haiti. I've been working in HIV infection, for example, for like decades. And now like death rate, like mortality for HIV infection has decreased by 75%. So it's like this is like very good result. Or for example, like new cases for HIV infections has dropped 25%, which is incredible because like they managed to make very important treatment available to everyone, like necessary in the world. And it is amazing. But also part of this, like the other side of this, it's like this $58 that we were talking about, like most of this was not allocated to surgery. Actually, like I look at this number, like it's 72% were for multiple conditions. So this is to say that we have always been operating in a very restricted supply environment, but now this situation is even way worse than ever because most of the supplies are coming from Port-au-Prince, and the medical supply chain has come to a complete stop right now, which means we can't deliver even the minimum that we used to do. And the way that we are dealing with this shortage is strictly by rationing the remaining of medical supply that we have in order to make it last as long as possible. And what that means is that we are basically keeping the limited supply that we have only for life-saving situations. we had to cancel all the elective cases in order to still be able to do emergency surgery when people need it. And as you can imagine, it is a very deleterious situation for patients who have literally no more access to very needed surgery they need.
You're muted, Dr. Perlyn.
Thank you, Meredith. Willy, I said your comments are reminding me of the Creole expression. I'll let you say it in Creole. You'll pronounce it better than I. But in English, mountains beyond mountains. Obviously, the title of Paul Farmer's famous book. After one struggle, there's just another, and that is what it sounds like you're describing. I was also thinking when you were talking, not unlike what much of the world experienced during COVID. When patients weren't coming to the hospitals and hospitals were shut down and there was a lot of delay in care. Are you seeing simple problems become much worse, ruptured appendix, things that should be treated and you should be able to take care of? I know the amazing work that you do in HUM or Laëlle in your hospitals. Are you seeing the shift of patients change and problems that should be easily treated becoming much worse because patients can't get the care?
Yes, of course. There is like delay in surgical care has always been like a huge problem. And like it existed before, but in situations like this where when transportation like is very difficult, actually in traveling to the country is almost impossible for many, and not accessible to many because it's very expensive. Because when there is like fuel shortages, people like it's very like transportation costs are skyrocketing. So it is very difficult for people. And actually, like Chair David mentioned earlier, like most of the people can't even reach the hospital. So it's like the very few lucky ones that are even like lucky enough to make it to the hospital.
I can't even get there. Yeah. Let's switch gears for a minute. Laëlle, I know one of your real interest and passion is on education, surgical education, and helping train future generations of physicians in Haiti. How do you think the instability has affected medical education now, and what do you see the long-term effects of this?
For now, medical education and training are considered one of the most affected sectors in this crisis. This situation has led to the sudden and complete closure of universities and training centers. It is crucial, it is very important to note that the majority of the training institutions, especially the medical training institution in Haiti, are located in Port-au-Prince, which is the epicenter of the crisis. And unfortunately, recently, many of them have been subject to looting and vandalism. This exacerbating the already tense atmosphere existing in the sector. However, now efforts are underway to maintain some forms of online training, which still remains very challenging because of limited access to electricity and reliable internet connection.
And have you seen this across all of the disciplines, of course, medical training, surgery, the residencies, but also nursing and others?
Exactly. The situation is the same for all the medical field in Haiti, because as I said, most of the university, medical school, like nursing schools, they are located in Haiti, and also most of the training centers are located in Port-au-Prince. In Port-au-Prince. And with this situation, it is very challenging to make them like work right now. And this has led to a kind of closure of all those facilities, and the medical training is right now like kind of closed in Haiti.
Yeah. And what are you seeing in terms of colleagues? I know you've been in the States for some time, of course, doing an MPH, and as we've discussed, or we'll be returning to Haiti to help there. Are colleagues staying? Are they leaving Haiti? What's the effect that you think this is going to have long term in terms of having a secure professional cohort in Haiti?
Yes, now our greatest concern lies in the inability to restore normalcy and during the continuous training of healthcare professionals for the future in Haiti. Because effective medical training relies on the presence of kind of experienced mentors and educators who can impart theoretical knowledge and practical skills, a process that currently constrained right now in Haiti by limited opportunities for exposure and practice for our medical students and residents. And unfortunately, medical education and training in Haiti are now also deprived from many talented domestic and international professors, mentors, trainers, and collaborators, as numerous individuals are compelled either to leave the country or to stay away due to safety concerns, not only for themselves, but also for their families. And as we know, the availability of appropriate and tailored training centers is imperative also for medical education. And I really think that without a swift return to stability, we are inevitably heading toward compromise training for our future professionals, which will negatively impact healthcare quality in Haiti and outcomes.
Yeah, and this is something that I think saddens so many people. Those who have been a part of healthcare in Haiti know the remarkable work that's done. Several fellows that I've had a very small role in training are on the call. Laëlle and Willy and Mackinson, some of the finest surgeons that I know, and I mean that sincerely. And I think it's important to also share that this loss won't only affect Haiti and care in Haiti, but beyond. Laëlle, as I said in your introduction, your work with Doctors and Borders and outside of Haiti. Willy, your work with the United Nations High Commission for Refugees and your work in Kenya. So this won't only affect the care in Haiti, but farther beyond. What do you think? Maybe Willy, maybe you can answer this. Obviously, so much discussion around the world right now, outside of the Haiti context, about the stresses of being physicians, being surgeons. Much of this we heard after the pandemic. You being in Mirbalais now, obviously a very different situation, a far more escalated situation. What are your feeling about the psychological toll that this is taking on you and your colleagues, the physician, the nurses, and others who want to be providing help and care and just don't have the ability to now because of the situation? Tell us a little bit about that.
Oh yeah, the situation is very distressful, both physically and mentally, I would say, because many of our staff are actually, like I said, like trapped in Port-au-Prince, which means the ones who are currently working have literally to spread themselves very thin, because the hospital is understaffed, we are very low on supply, and we are working under significant stress. We have to make very difficult decisions on what to treat, and it is an heartbreaking situation to have to tell patients that we can't provide them a surgery, for example, that they desperately need in order to prioritize order. And that's a situation that no healthcare worker wants to be in. So it is very distressful. And the situation in Mirbalais is very specific as well, because as of like last September, we are under attack. And I don't know if you heard about it, but a gang in Port-au-Prince went the town of Mirbalais, including the hospital, which has caused great panic among the staff in the entire population, in the entire community of New Valley. To date, there are constant rumors of further attack on the hospital. But like I mentioned earlier, many of our staff have families who are seeing problems and they can't go back to them, and I'm sure they are very stressing about them.
Yeah, the last time that I had the privilege of operating with Willy was 2019. If you had to mark the day of the beginning of all of this turmoil, that was the day. And that was a stressful day. Of course, Willy and I experienced a gun battle outside the hospital and took care of several of the patients that day before we were evacuated. That was a stressful situation for a few hours. I cannot imagine the toll that you and your colleagues go through every day in trying to provide the care now, and the security issues, as you mentioned, with what happened there and at several of the other hospitals. So thank you for all that you do, because it must be a tremendous burden of stress. Laëlle, what are your thoughts now in terms of what Haiti needs? Obviously, it's a big question and not one that we're going to solve here tonight by any means. Sheila Davis mentioned earlier in her comment the push right now for humanitarian corridors and some of the UN air work and other things. But any thoughts you have from your perspective and that of your colleagues about what Haiti needs now to be able to get even the most primitive of resources back in the healthcare system to get it restarted?
Honestly, I think right now what we need is supplies, materials, equipment to enable all the hospitals and education centers to effectively serve the population. But also, I really think that it is important to recognize that the medical sector is a part of a whole. And to be sustainable, the medical sector will depend on other contributors. I think now what we need is a kind of collaboration from all other stakeholders to facilitate the transportation of equipment and also the movement of healthcare providers, including the trainers, the trainees, the medical students, as well as the patients. And also now we need to ensure the availability of services such as electricity, internet connection, and also running water. Those things are very crucial. And I will say that there is an urgent need for a cessation of hostilities and a return to calm to facilitate the resumption and optimal functioning of these institutions in Haiti right now.
Yeah, let's all hope so. There was a news articles today about the beginning of discussion about potentially a new government. So I'm sure we'll all be watching closely to see what comes of that. It's interesting you mentioned the electricity as well. There was a conversation going on yesterday about St. Damien Hospital and their lack of electricity right now and the possibilities of installing solar panels. I'm not sure if any of the folks from Kids OR are on the call. They're a wonderful organization that builds pediatric operating rooms around the world. And they were working through some logistics yesterday, trying to get solar panels that they've used before into the country now, and working through those challenges to just get, as you said, electricity to the hospitals. So much need there now. Willy, do you want to make any last remarks or comments? And then I think we'll save a couple of minutes to open it up if there's any questions or additional discussion.
Yes, sure. First of all, thank you for making this happen, for having this conversation, because I think it is very important to not only to to talk about what's happening right now in the country, but also to advocate for all of the people actually who are suffering and desperately need access to healthcare. Because I know this is what like a lot of people here have been fighting for, which is like access to healthcare. And we are right now in a situation where like people, and including the most vulnerable, including children. So, and for example, I will say, I mean, I know I don't have a lot of time, but in my practice, like roughly 40% of my patients are children, because as you know, like in plastic surgery, we do a lot of cleft palate reconstruction, facial cleft, like a lot of congenital malformation, and hypospadias, like in syndactyly, and of course, like now they are not being considered as emergency surgery. So we literally have to stop, and we can't do any of these cases. And even for the emergent cases, it's very hard to do because there's we are lacking essential equipment and materials. Like for example, even when there is a trauma, there is like no access to blood product, right? Because we have a very centralized blood banking system, and if it's poor with its blood, there's nothing we can do. And so I'll be calling for, and I think the real solution is going to be like to restore law and order in the country, because that's what's happening. Now we have a lot of people that are basically like 2 million of people actually being besieged in Port-au-Prince by gang members, and that's why we need to be, I think, unless this is resolving, we're never gonna be able to increase access to healthcare for these vulnerable people that we are trying to care for.
Yeah, and it is heartbreaking when you know the amazing work that you do and the incredible care that you and all your colleagues both provide, and to think of it not going on despite all the effort over all the years to get to the level of really wonderful success that you've all been able to have, and now to see it halt so abruptly over these last few years. So I appreciate both of your comments. Magginson, I saw you had come off mute. I'm happy to open this up now for discussion and questions.
Good afternoon, everybody. I am Mackinson. I'm happy to be a part of this meeting, and I want to take some time to thank you graciously, Dr. Perlyn, for having taken this initiative with your team, so we can discuss a little bit about the current situation in Haiti. And as everyone knows, it's something terrible, it's unprecedented, and it's indescribable. But right now, to give a little bit of answer to one of the questions you asked, how can we support the Haitian people right now? It's a little bit difficult. Like any type of foreign intervention would need to have some sort of a local leadership, strong leadership, people with vision, people with skills, knowledge, and the willingness to get things to change in a very positive way and in a sustainable way. As of now, because people are stuck, Port-au-Prince is under siege, and around 2 to 3 million people are stuck there, and the roads are blocked all over. And like right now this afternoon, family members just told me that the neighborhood where all my family is living right now it's like, we have like only for today we have 20 people who got shot and they died, and my mother is in danger, my brothers, all my family members right now. I don't know for the upcoming hour what kind of news I'm gonna have from them, but it's the situation is really terrible. I've been on the phone with one of my nephew, and I could easily hear the heavy sound of rifle, and I don't really know what's going on. But one of the way that we might be able to help is to see how we can promote telemedicine, because no one is able to travel right now. But if there's some sort of assistance that we can provide remotely to people, like having some open line where people can say what they have, and even with an advice, we can tell them what they should do to stay alive by the time we get the opportunity to provide definitive care. I think that help the most. Because even if we tell people that, okay, if you get shot, go to the hospital, doctors are not able to travel to the hospital, specifically. And, and most of the things that right now are happening in Port-au-Prince, so you won't be able to travel to go anywhere else. You can't go to the countryside. You can't go to any other major hospital. So the only thing that you can do right now is to use your knowledge and tell people what they might be able to do, what they can use in their direct environment that might help them to remain alive by the time find a way to figure out a way to
That's a
provide
really
this.
interesting point, Magazine, and one that I think we can take back. And Willie, maybe we can have some conversations around that offline about educating people what to do if they do have situations and can't get access to care that could be life-saving. It's obviously a significant project, but I think you raise a really important point, Magazine, and certainly through PIH and the G4 and others, I do think that that's a very interesting thought and suggestion. Are there any other questions or comments?
Yes, I have one.
Jen? Yeah, please, and introduce yourself and tell us who you are and your background and so forth.
Okay. I'm Jean Dillner. I'm the CEO of Sign Fracture Care. Sign has been in Haiti for many years, training orthopedics. And so we're equally hurt by the situation, hurt for our friends in Haiti. And we're here on this call to find out if there's alternate ways to get equipment in, because I know they are doing surgeries. And then you mentioned supplies. Is there a place we can go, a list on a website somewhere we can look at to see if we can source some of those supplies in addition to the orthopedic equipment that we send in when we can now lately? And then I like the telemedicine idea, and I like it that Ohana One is on this call because they are experts at that.
Thanks,
Yep.
Jean.
Perfect. But before I'll pitch it over to Ohana One. Maybe Willie, I saw Krista. I know Sheila had to drop off, but I saw Krista on the call. And maybe if Krista's available, hi Krista. So Krista is one of the senior development officers with PIH and incredibly involved. I don't know if this is an appropriate moment for you to talk a little bit about maybe supplies or needs or resources, and if so, not to put you on the spot, but we can perhaps send something out in the email afterwards and try to get some concrete answers to your question, Jen.
Yeah, I mean, I will just say that getting supplies is a challenge for everybody that is working in Haiti right now. And unfortunately, there isn't a solution at the moment that we can see. This is one of the reasons that Sheila mentioned, really trying to get a humanitarian corridor set up to try to get supplies in through the Dominican Republic, and really advocating with the Dominican Republic, who's closed most of their borders as well, to try to allow supplies to come in. There are lots of organizations that have containers in the port. So some things are sitting there and either you can't access them or some of those containers have been looted. And so it's a big challenge, and that's one of the biggest concerns we have, and why we think that the humanitarian situation is going to get worse. It's not only medical supplies, it's food as well. You know, if the ports aren't open, if you can't get things across the border, people's access to food. So I wish that I had an answer for you to say, this place has supplies, this is where you can go, this is how you can get them in. But it's a challenge and a logistics question that we're all trying to figure out right now.
Will G4 be able to set up something on their website so that those of us who are trying to help have information, you know, because who's going to be the organization that is tracking the the supply chain and, you know, the resources that are needed, et cetera.
We will certainly put out some calls to action, if you will. It's not the right word, but to see if there are resources. I've been hearing a lot of chatter through different things about trying to bring things to the Dominican or others. I have not yet heard of one effective, reliable pathway to get supplies into the country. But certainly I will follow up with Claudio about that. And if we do find things that are reliable and appropriate, we'll 100% share them. And I wrote down your information, so I'll make sure we follow up directly with you.
Thank you.
With you as well. So thank you.
Mhm.
The Ohana One folks, did you want to? I'm sorry, I don't know your
I just
name, but I see you as Ohana One.
Yeah, it's not in there. Sorry about that. Thank you. We are proud members of the G4 Alliance, and I used to work for another organization that spent numerous time in Haiti, and know Father Rick very well in St. Damien Hospital, where we've done surgical missions there too. We are providers of telehealth. We're a nonprofit organization, and we do telemedicine and telehealth through grants for nonprofit organizations such as Sign Fracture that's utilizing it to do long distance surgical education. We've deployed the software and the hardware to the Ukraine, or I'm sorry, to Ukraine for help in you know, when they're having issues. It's also sitting in Armenia, being helped in their conflict areas as well. So, you know, you can use it regularly or whatever, but it does allow for that telehealth and telementoring to happen through a software. Usually we do it through either some glasses or a camera, but it does work software to software, so you could be doing it on your phone. And so we don't need to worry about getting any hardware over there. But I'm happy I put my phone, my email in the chat, and I would be more than happy to make sure to work with whomever needs it to get the licenses and to get you moving on that as fast as possible. There's no cost whatsoever. We do all the training, all the onboarding.
That's amazing. And maybe Willy will connect you after, and
Please.
Laëlle and I know Mackinson, so you can share with your colleagues as well. That's amazing. Thank you.
You're very welcome, of course.
Amazing. Any other questions or comments to be raised? If not, thank you all so much. This is obviously a difficult conversation. I do want to say I think it's incredibly important for a few reasons. One, although these calls don't directly impact change, I do believe they do bring awareness and advocacy. And I think this is so important right now. And I know this is recorded and being shared elsewhere. And I think, Laëlle, you said it very well, that the medical community needs to be one family, essentially, especially at times like this. And it's impossible for us to make sweeping change on a geopolitical scale through a call like this. But I do truly believe that talking to our colleagues and sharing what's happening and bringing it to people's attention is the first step. There are some really good calls to action that are happening now, and we'll be happy to share this information as well in terms of work from groups like the HHN and their advocacy work in terms of letters that can be sent to U.S. officials in terms of the humanitarian aid awareness and the need for influence in terms of helping up open humanitarian corridors and others to get care. I also think that this is really important in hearing the voices of Willy and Laëlle, and thank you, Mackinson, for joining. But Willy and Laëlle, both of you continue to be absolutely shining stars in Haiti and far beyond. And as I think many of us would feel who've been involved in teaching or education for a long time, the best thing you can see is those who you've played a small part in go on and to have tremendous success, both of which I know you've had clinically, and now hearing and watching you as leaders and advocates for Haiti and beyond, and hearing the strength in your voices tonight is something that I know makes us all very proud to know you and play any part that we can in what's going on and beyond. So with that, I think I'll wrap it up. My comments, Willy or Laëlle, the floor is yours if you want to make any last remarks. And thank you everyone for joining, and we'll continue this conversation. And thank you to our fracture care folks in Ohana One and everyone else. So thank you. You're on mute, Willy.
Thank you very much. It was a pleasure to be here.
Thanks for being here. Laëlle?
Thank you so much, everyone. Thank you, Dr. Perlyn. The last thing I want to say is that Haiti is a country renowned for its historic resistance against slavery, injustice, and social inequity. And this country today is currently facing profound challenges. All Asian citizens and the global community must understand that to overcome these challenges, we need a break, we need peace. And it is very essential to address the ongoing humanitarian crisis adequately and urgently. I really believe that by uniting our efforts, we are capable and we will succeed in achieving this goal. Thank you so much again.
Thank you, Laëlle. And with that, I think we'll say bonsoir. Good night to everyone, and we really appreciate it. And please continue to spread the word about the need in Haiti. Thank you all so much. Good night.
Thank you.